Hi, Dr. Islam here. So today we're doing some prolotherapy injections for our patient's nagging back pain that he's been having. Prolotherapy is proliferative therapy, which is where we're using some sort of solution to create some wound healing inflammation, such as sodium moreuate, glycerin, phenol, dextrose. And what this does, it actually creates some inflammation. So you go through a cascade where you have, well, think if you got a cut and you go through the inflammatory phase and builds all this goo. Then you have a matrices phase where it builds up all this tissue, and then you have a remodeling phase where it comes back to normal tissue. Okay, this is what prolotherapy does. Now, PRP, exosomes, stem cells, growth hormone, these are all part of the regenerative cascade of things that you can do. Steroids, on the other hand, degrade, they mask the inflammation, or NSAIDs mask the inflammation, but they don't actually help rebuild. So think of it like this: ligaments and tendons, which are bone-to-bone connections, and muscle-to-bone connections, they don't heal properly because there's not a lot of blood supply. So actually, muscles in general heal well, right? And actually, when you go to the gym, you're actually tearing the muscle, give it some rest, it builds, tear, build, tear. But that's because there's a lot of blood supply to actually help provide the elements that are needed to build that muscle. Ligaments don't have that. So when you have an injury to that ligament or tendon, it ends up being that it creates a nagging injury. That being said, we're doing this patient's thoracic area, and there's a lot of anatomy, so we're actually, you want to go to somebody who's skilled in it. But prolotherapy can take a couple sessions, but it does very well for patients. If you have any questions, reach out.